Hello, how are you? It's Dr. Rajeev Fernando, Chief of Infectious Disease at Stony Brook Southampton Hospital. Thanks for joining us.
Thank you, Dr. Fernando, for taking the time to speak to us today. We've got some questions for you. The first is concerning masks and the idea that they may be indeed coming down the pike for us.
Yes, I think the CDC is opposed to changing these guidelines. There's new evidence that the virus could be transmitting more than 6 feet, and I think we're up for some new guidelines. With regards to a mask, I'm not sure whether it's going to be a mask specifically. It could also be some sort of protective clothing as well.
If someone gets COVID-19 this spring and recovers, are they likely to have immunity from catching it again?
Great question. My feel is they will have a certain degree of immunity, but that really depends on whether things change in the fall. Now, analogous to this, we see influenza. People get influenza, they get antibodies formed towards it, but once there's a mutation in the influenza virus, you could see mutations and people get sick all over again. So that is the possibility over here with coronavirus as well.
So do you think that warmer weather could have an impact on the virus?
Yes, the data we have so far suggests that 90% of infections are transmitted between 37 degrees and 62 degrees Fahrenheit. So that's the vast portion of infections. Over this temperature, we have about 10% of infections being transmitted over 62 degrees Fahrenheit. So that's important to know. I think the weather will definitely decrease the transmission, but they will still be ongoing transmission at a lesser level.
So then there is a possibility that everything could flare up in the fall.
Absolutely. Unfortunately, that's the truth.
Well, here's a question that's sort of out there, but we're going to share it with you.
I love out there questions.
Okay, all right, you got one. Can hot air, say a hairdryer, be used to decontaminate a mask or clothing?
In theory, great idea. I wouldn't recommend it.
Thank you. What is the latest information on whether the virus is mutating?
Great question. So at this point, human beings are being pounded by this coronavirus right now. So the coronavirus is being effectively transmitted to human beings at a very good pace. Now, the minute the coronavirus is unable to transmit at this rate that we have right now, that's when the coronavirus says, wait a minute, I'm not transmitting as effective as I was before. It's time to mutate and switch things up. That's when we'll have evidence. At this point, I think there's no need for an evolutionary change with the coronavirus right now.
So can everybody get tested now?
You know, I think the guidelines for being tested were unfortunately made based on lack of testing abilities, lack of PPEs. But I think as more testing kits become available, I think a lot more people will be able to get tested. Your clinician will make that final decision.
Have there been some issues with false negatives?
Yes, unfortunately so. Some of the testing sensitivities, it can be with regards to false positives, sometimes the test is only 65% sensitive. So that's a big problem, leaving a big way for false negatives to come out.
How close is it for us to have a treatment, or if not a treatment, is there the possibility of a vaccine?
I'll address the vaccine question first. Once again, in the United States, we're on top of our stuff. We have an accelerated process that's going on. I'm fairly confident we'll have a vaccine by November. With regards to treatment, once again, we are second to none. The United States, where we have our scientists, researchers develop things as we speak. So hopefully, we're in hope. We hope that they will come up with something soon, so we at the front lines can use this to treat our patients.
Okay, now going back outside again and being exposed, should you cover your hair before going out?
I don't think that's unreasonable. Certainly the CDC hasn't specified hair, but absolutely, totally good idea.
Well, what about changing your clothes when you come home?
I would definitely do that. As soon as you come home, try to take off these possibly soiled clothes at the entrance and try to get a shower as soon as you can.
Okay, now, what about widespread disinfecting public spaces? Is that an option? What do you think about that?
I think that's a great idea. Now, countries who have flattened the curve, like China and South Korea, which really is my top country, how they turn things around. We've seen evidence of them disinfecting public spaces, and I perfectly agree that's a good idea.
How does the virus respond to refrigerator temperatures?
Can't comment on that. Don't know enough information.
And what about freezer temperatures?
Same thing.
Okay, now, but does it break down faster if it's on a food package?
Yeah, there's just to talk about this logistically. Like we mentioned before, the virus won't survive in temperatures higher than 62. If you have higher than 62 and high humidity levels, it's a very good chance the virus won't survive. Hashtag, you can put something in your microwave and heat it up, and you should be able to kill the virus.
Okay, so this is an important question. If indeed you live in a household with a variety of other people and somebody does indeed become positive for COVID-19 and or is sick, how on earth can you take care of them?
These are really tough questions, and I understand. I have to take this with a grain of salt because I know it's really difficult for people at home looking after an infected person. What I would do over here is make sure the person infected wears a mask and you wear a mask as well. Let's take that 6 feet rule out of the picture right now. I'll go ahead by saying anyone who's taking care of a sick person should be wearing some sort of protection. That's the only way to do it. We have something called a secondary attack rate. Research suggests that it's about 10 to 15% with a secondary attack rate from an infected person to a non-infected person in the house. Those numbers are promising, and as long as you establish that with social distancing, Clorox, hand washing, you're in good shape.
So if the person who is sick were to remain isolated as much as possible in one room, and the caretaker were to go in, wear a mask, and the patient were to wear a mask,
absolutely,
that would help a lot.
Absolutely.
And would it be beneficial if indeed the caretaker were to take off their clothes and take a shower after ministering to the patient?
These are great questions, and the answer is an overwhelming yes for me.
Well, so when you're sick, there's nothing more than you like to cuddle with than your pet. So tell us, can pets get sick with the virus?
Well, we have some data which says, dogs can be infected. We have one case. They can be carriers. I haven't seen any evidence of COVID disease in animals like dogs or cats. We know they can be carriers, but no slam dunk transmission to human beings at this point. We have to watch very closely.
But it's very, very rare.
Extraordinarily rare.
Okay, so that's good to hear. Does the virus actually live?
Yes, the virus needs to be in a human cell to live. If it's not in a human cell, it will die. This is unlike bacteria, which can hang around for days and days and days. The virus needs to hijack a human cell, and once it gets into a human cell, that's how it survives.
Okay, so you're talking about a virus, but the next question is, does the use of antibacterial soap help?
I think you just answered your question right there. An antibacterial is to kill bacteria. They don't kill viruses. Your good old soap and water is good to go.
Are there any holistic measures that can prevent you from getting the virus, such as vitamins or natural substances?
Yeah, I think in theory, anything you can use to boost your immune system, vitamin C, vitamin D, and zinc have been well studied to enhance your immune system. Good to go.
Right, but that's enhancing the immune system, but not necessarily preventive of it.
Yes, there's some data about intravenous vitamin C, but that's been used only for hospitalized patients. For now, I think what we just discussed, vitamin C, vitamin D, and zinc oral format we're in good shape.
Do I need to leave delivered packages sitting outside for a certain amount of time before it's safe to bring them in?
I think what you should do is you can bring them in. What you should do is Clorox or Lysol the surface. Whenever in doubt, just Clorox or Lysol the surfaces.
What about just some soap and water? Would that work too?
I think that's reasonable for your hands, but any sort of surface, I always advise Clorox or Lysol or bleach.
That's good to know. So then this is the next question. I have a feeling I know the answer. Should I wipe down everything I purchased from a grocery store before bringing it in?
You got it. Not the groceries itself, but anytime you go into a supermarket, I feel certainly wearing gloves would be helpful. And once again, if you see there's an area of concern, go ahead and Lysol or Clorox that surface. Even if it's in a public property, go for it. It's important.
What is the key to ending this crisis?
Yeah, the key to ending this crisis really is aggressive social distancing. Now, I'm hoping the CDC will update their guidelines in the next couple of days about protection. That's going to be very big. That in conjunction or in synergy with aggressive social distancing is the only way we can save our country.
So here's a big question. When will we know when there's a turning point we can start going back to our lives?
Well, for starters, I do want us to think that, first of all, there's light at the end of a tunnel. every epidemic will end, and we will successfully end this. The matter of when we will end this epidemic is up to you and me. If you aggressively social distance, protection, we will end it sooner rather than later, but always have hope. Create a nice playlist at home where you play your top 10 pandemic playlists, play video games, or do what you gotta do, but have hope. The most important thing, there will be light at the end of the tunnel, and we will beat this America. It's very important.
So if we were to stop all the precautions and physical distancing, could this flare up again?
Absolutely. Absolutely.
We don't want to hear that. So we got to maintain the social distancing.
It's very difficult, but that's what we should be doing right now. With regards to your prior question on when you think this will end, I really think at this point we're having a surge of cases. Cases are increasing every day all over New York, all over the United States. In order to say we're stabilizing, it's very important to have a number of days with consistent hospitalizations or decreasing hospitalizations before we can say we're in the clear. And also remember, even on the downturn on the curve, we should still continue to aggressively social distance at this point. It's not over as we finish the peak and we're going down. Continuously social distancing.
So how does the outbreak compare to historic pandemics and epidemics?
So infectious disease doctors, we believe in something called disease X, which is the disease which marks the century. And for us, obviously, it was the 1918 Spanish flu, which wiped out 50 million people. 500 million people got sick and wiped out 50 million. For me, this is the disease X of this century. We haven't had anything like this over the past 100 years. We've had swine flu, we've had other outbreaks, but nothing in comparison to this. So this is very important, and we should take it seriously.
Thank you very much, Dr. Fernando, for your time. We really do appreciate it.
Thanks so much for having me, and it's an honor to give information to the public. Thank you.